As of the end of 2022, an estimated 39 million people were living with HIV worldwide and 1.3 million people acquired HIV, whereas 630,000 people died from HIV-related causes globally. People living with HIV/AIDS require significant medical care, leading to increased healthcare costs while decreasing the income and the opportunity to work. Also, the epidemic has left behind many orphans, and such societal impact also has economic implications. Today's video will be about the basic of HIV/AIDS so that we can understand more about the disease in 2024. Hopefully, it will help raise our awareness to this condition. Firstly, what is HIV and what is AIDS? HIV stands for Human Immunodeficiency Virus, is the cause of HIV infection and eventually leads to the acquired immunodeficiency syndrome, or AIDS, if left untreated. The virus is primarily transmitted through certain body fluids during unprotected sex, sharing injection drug equipment, or from mother to child during pregnancy, childbirth, or breastfeeding. HIV infection is special because it can weaken your immune system, so you may get sick very easily. AIDS occurs when the body's immune system is very badly damaged due to the virus, making a person way more susceptible to a wider range of infections known as opportunistic infections. These infections take advantage of a weakened immune system and can lead to severe illnesses, even fatal conditions that the body would normally be able to fight off. Fortunately, with early diagnosis and proper treatment, people with HIV can live long and healthy lives. So, what can HIV do to your body? HIV is a type of retrovirus that adversely infects the immune system of a human, mainly targeting the CD4 T helper cells, accessory cells, and the macrophages. The virus now can either become dormant or conceal itself from the detection system, or it can get transcribed into new viral RNA and proteins that are released from the cell and begin the cycle again. In short, it can hide from your immune system while also weaken it. HIV can be characterized into two major classes, HIV-1 and HIV-2. HIV-1, which is more virulent and is the major cause of HIV in humans, was discovered first. HIV-2 is less infective and therefore far fewer people exposed to it are infected. The crucial factor in gaining entry into target cell is through binding of HIV to the CD4 receptor present on our T helper cells and to one of the chemokine receptors, either CCR5 or CXCR4, on our cells. This information is very important because as for now, there are only 2 patients known to get rid of HIV, and both of them were receiving stem cells with CCR5 mutations. Although this way to get rid of HIV is dangerous and fatal, it sure does spark hope of medical research about the potential cure of HIV/AIDS. You may ask, what does patients with HIV look like? Well, people with HIV may not show any visible signs of the disease, especially in the early stages. The only way to know for sure if you have HIV is to get tested. However, some people may experience symptoms, especially during the initial stage of infection or if the disease progresses to AIDS. These symptoms can include flu-like symptoms such as fever, chills, rash, night sweats, muscle aches, sore throat, fatigue, and swollen lymph nodes. Red, brown, pink, or purplish blotches on or under the skin or inside the mouth, nose, or eyelids. Significant weight loss, often accompanied by diarrhea, chronic weakness, and fever. Neurological complications such as confusion, forgetfulness, depression, anxiety, and difficulty walking. It's important to note that these symptoms can also be related to other illnesses. If you or someone else is experiencing these symptoms, it's important to seek medical advice. Remember, early detection and treatment can help people with HIV live long and healthy lives. And here is one vital note. Is there any cure to the HIV? Sadly to say, as of now, there is no cure for HIV/AIDS. Once you have the infection, your body cannot get rid of it. However, with access to effective HIV prevention, diagnosis, treatment, and care, including for opportunistic infections, HIV infection has become a manageable chronic health condition, enabling people living with HIV to live long and healthy lives. Antiretroviral therapy, or ART, has been a major breakthrough that does help suppress the virus, but it's still not a cure. Even so, progress is being made. There are news about the Berlin patient and the London patient, which are the 2 cases of individuals who have been functionally cured of HIV. The Berlin patient is Timothy Ray Brown, who underwent a transplant of stem cells derived from another person's bone marrow and remained free of infection thereafter. We need to note that the stem cells were from donor having the CCR5 D32 mutation, which can resist HIV. This procedure was performed to treat blood cancer, but it also cured him of HIV. The London patient is Adam Castillo, who has become the second person in the world to be cured of HIV. To cure blood cancer, he received a transplant of stem cells from a donor who was naturally resistant to HIV, which means the donor also had the CCR5D32 mutation. After the transplant, the HIV-resistant cells replaced the non-resistant cells in his body. As of the report in 2021, he has been in HIV remission for 30 months with no detectable virus in blood, cerebrospinal fluid, intestinal tissue, or lymphoid tissue. These cases represent significant milestones in the ongoing research for a cure for HIV. However, stem cell transplants are risky and have severe side effects, making them an unrealistic strategy for a large-scale cure. Research is ongoing to find safer and more effective cures. That should be the end of today's video. Hope this helped you know more about the HIV/AIDS disease. If you want to know more, please consider subscribe to the channel as there will be more to come. Thanks for watching and see you in the next video.
The information provided on this channel is for general informational and educational purposes only and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have seen or heard on this channel.